Hey guys, it is Dr. Rico here with a video, and as promised, it is the first Monday of September and I am coming with you with an elite experience video where I just give you guys an insight on how I diagnose to treat and how we do things with natural medicine. And my specialty is integrative sport medicine, where I focus on acupuncture, and so we're definitely going to get in and just show you guys what it is that I do and how I diagnose. I don't want to keep you guys long, but I definitely want to give you guys an insight, so hopefully this information is informative, and by the sound of that, that means class is in session. See you soon. Hey guys, we are back and we are in session. Class has started. We're just going to go through, and there was one in particular that I kept seeing over and over and over again, and I knew that that was probably going to be the first question, so I said, why not? I get asked this question all the time, and I understand why, because people are not familiar with the medicine. So with that being said, the topic for today's video is going to be, what is acupuncture? Most people think that acupuncture is this.
Maybe you should try Jenny Craig.
But I want to assure you guys that that is not what acupuncture is at all. There are three main focuses that acupuncturists or acupuncture physicians or people of natural medicine tend to focus on: increasing your serotonin, promoting blood circulation, and pain relief. So for most people, if you don't know what serotonin is, serotonin or 5-hydroxytryptamine is just a chemical that your body releases. Most people call it the happy chemical because what it does, it increases your mood, it promotes calmness, great overall well-being, and overall happiness. So we strive really hard when you come to an acupuncturist to promote that feeling of happiness, promote that feeling of calmness, tranquility, peace. Also blood circulation. A lot of people don't understand that the reason why you have pain, first of all, is because blood is stagnant. What does that mean? It's because blood is not moving. Blood is still, and when blood is not moving, that's when we have pain. So the best way to avoid pain is to constantly be active, constantly move, constantly find something to do that'll help you alleviate your pain. Acupuncture, I like to give my patients this analogy. When you're building a house, you put on the walls, you put on the roof, you put on everything that the house needs in order to be a house, right? But what actually gives life to a house? And I like to think that when we apply electricity to the house is when everything in the house can come to life. We can use our TV, we can use our ovens, electronic devices. Why? Because we've given a heartbeat to the house. And just like acupuncture, we do the same thing. So how do we do that exactly? Well, we actually use needles to stimulate certain specific acupoints or acupuncture points in the body that can trigger electrical responses and pulses and create histamine reactions. And the histamine is actually the redness that you'll see around the needle once you hit that needle right at the right angle in the right spot and you begin to stimulate. You'll see a redness around the needle. Now for us, that's a good thing. That's letting us know that we found the chi. The chi means the arrival of chi based on whatever meridian we're trying to target, or whatever the diagnosis or the plan is, can create the body to then internally heal itself naturally. So what we like to do is, I'm going to take this opportunity to actually show you. Now this one, I'll start with the smallest one. So we'll start with the smallest one. So in Chinese medicine, they use sun measurement or chun measurement. We can go from as small as 0.5 inches, a sun is an inch, or up to, I've seen 7 sun. So, and I'll show you how thin these needles are. A lot of the people that I come in contact, their fear is they have needle phobia, which is the fear of getting stuck by needles or seeing a needle. They just panic and freak out. But I assure you that there is nothing, you guys, nothing. I promise you, nothing. And I've had to make believers out of some people in regards, because these needles are as thin as a piece of hair. So that this is a half a sun needle here, 1 sun needle here, This one, okay, again, do not be alarmed. We use this size, usually like the 3 to 5 to 7 sun needles for bigger muscles, bigger body compositions, to help get into the muscle or get to whatever level we're treating. So this one is I believe it's a 3 or 5 sun. Those are what we use in order to create that idea of electricity giving life. Like I said before, allowing the body to naturally heal itself. Alright, so really quick, we'll just get into some more other questions before my iPad dies. So I'll just run along with what is acupuncture. A lot of people included in these a few things. Pretty much the history of acupuncture goes back thousands and thousands, almost 2,000 to 3,000, maybe even longer than that recorded of history. So this medicine is not something that somebody just woke up yesterday and said, hey, I want to my iPad just died. I want to create a new medicine. No, it's been around a very long time, trusted by many and used by a lot. So I just wanted to get into that. My iPad's back on, so we will get right back into it really quickly. So that was just a brief history of what acupuncture is. How to prepare. I always tell my patients when they come to get a treatment from me, make sure that you A, arrive 15 minutes early, B, eat before you come, and dress comfortably. Next question is, does it hurt? Unless you're dealing with a highly sensitive area like your hands or your feet, or if you're in an acute state, chances are it's not going to hurt at all, especially if you have a practitioner like me who knows what they're doing. I'm just saying. How deep do the needles go, they ask. The needles go as far as we need them to go. Like I said, it depends on what level we're trying to achieve. If there's something wrong with the bones, or we have to go to bone level. If it's something muscle level, blood level, chi level, which is superficial level, or anything like that, that's how far we go. We do have specific areas that we as practitioners know we must avoid, depths as far as like the thoracic area, in the front, in the back. You know, if there are any areas close to arteries, major arteries and veins, you know, we have to avoid deep needling to avoid, like I said, in the chest, for example. You don't want to needle too deep. And then there's specific angles you want to avoid going perpendicular in that area to avoid pneumothorax. Pneumothorax is just a collapsing of a lung. How safe is it? It is extremely safe. Like I said, there you can Google, you can research, you can do your own homework to find out there are no major cases where acupuncture has actually caused fatalities or anything. Like I said, the most that could possibly happen is someone gets a pneumothorax. That's pretty much it. Otherwise, it is highly safe, no side effects, and like I said, requested by a lot of people. Can it be done for children? Absolutely. Babies, infants, toddlers, teenagers, adults, the elderly. I personally would only treat age 7 and above. That's just my specific personal preference, but absolutely, there's ways we go about doing it. But yes, indeed, it's definitely safe for children. Well, you guys know what that sound means. Class is dismissed. Whew. I just thank you guys for taking the time to listen to me, taking the time to understand what I do, and you know, the foundation of this medicine and the things that we use or could potentially use in order to treat you, in order to heal you, in order to make your life a lot better. I really appreciate the DMs. Do not forget to DM me your questions. DM me your case studies. Remember, your case studies especially are anonymous. The format is your age, your gender, your chief complaint, meaning if your back pain is your focus, and the symptomology, you know, what's manifesting with those back pain problems. So the more details you give me, the more I can go into depth as to how we would, or I would, diagnose, and you know, the game plan, what we would do to treat you. So I really thank you guys. See you guys next Monday, and remember, healing begins within. Take care.